Welcome to the Introduction to Scholarly Research video series. This is video 2, Background and Foreground Questions and Databases. By the end of this tutorial, students will understand the difference between background and foreground questions, their corresponding background and foreground databases, and know when to use each. One question we get a lot at the library is which of the many databases that we subscribe to should students use for particular problems or questions? And the answer is that you want to choose a database based on the type of question you're asking. Is your question a background question or a foreground question? Based on your answer, you can more easily choose where to start your searching. So what's the difference? Background questions are those broad questions that arise when you need more general knowledge or information, and by answering them, you're giving yourself a better overall understanding of your topic. Any questions asked in medical scholarship or in class, for example, would be considered a background question. You're trying to find out more about a posed problem or question. Foreground questions, on the other hand, are highly focused questions that are asked at the point of care, the answers to which provide specific information for you to add to your knowledge base and help inform your clinical decision-making. Anytime you have a patient in front of you asking you a question you don't know the whole answer to, that is a foreground question. Now that we understand the difference between background and foreground questions, let's take a look at their corresponding databases. The background databases here could be called the Big Five: Embase, Medline, PubMed, Scopus, and Web of Science. These are all biomedical literature citation databases. Each will get you that unfiltered primary and secondary research necessary to complete a good lit search or a class assignment. They also each offer their own unique little extras. Embase places a lot more focus on pharmacology and medical devices. Medline's interface allows you to build up a search piece by piece without having to know how to build a search string. Scopus houses extensive author and affiliation pages and makes citation chaining a lot easier than some other databases. And Web of Science takes a more global and multidisciplinary approach that focuses on only the most highly cited literature. I would recommend searching both PubMed and Embase at the very least every single time you find yourself researching a background question. You can then round out your search with one of the other three. The foreground databases aren't resources that you would use a lot in your first couple of years unless you're working on a project that has clinical implications, in which case you may want to see what they're telling practitioners and move backwards through the literature, making your way from the clinical recommendation to the science behind it. These three databases are the main point of care databases that you will use during your clerkships. Practitioners use these to supplement what they know when they need quicker, filtered answers to questions. If you want to double check that the treatment plan you've come up with is the best for this particular patient, but you don't want to slog through 20-page studies to prove that you're right? You want something quick and easy to digest, and that's what these databases do in different ways. For more information on the individual parts of the scholarly work process, you can view the complete series on the medical scholarship and medical databases LibGuides. Each tutorial is only about 5 minutes and will give you a good overview of the entire process. If you have any questions about any aspect of scholarly work, please do not hesitate to contact either of your health sciences librarians. Our jobs revolve around this exact process, and we'd be happy to help you through it. Thank you.